The healthcare needs of transgender individuals are both unique and often underserved. Despite increasing awareness of gender diversity, the healthcare system still has significant gaps in meeting the needs of transgender people. In addition to experiencing barriers to accessing necessary medical and mental health services, transgender individuals face widespread discrimination and a lack of understanding from healthcare providers. This video delves into these specific healthcare needs and offers insights into ways the system can evolve to better support transgender individuals. Gender dysphoria is a critical and often overlooked aspect of transgender healthcare. It is defined as the psychological distress that arises when a person's gender identity does not align with the gender assigned to them at birth. Transgender individuals frequently experience anxiety, depression, and social isolation as a result of both gender dysphoria and external factors, such as societal stigma and discrimination. Addressing these challenges requires healthcare providers to have a deep understanding of gender dysphoria, as well as a compassionate approach to care. Therapists and counselors trained in gender identity issues play a crucial role in helping individuals explore their gender identity, cope with dysphoria, and navigate the journey of transition. Supportive therapy helps transgender individuals build resilience and improve mental health outcomes. However, mental health services must be affirming, meaning that providers respect and support the person's gender identity, rather than viewing it as a problem to be fixed. Mental health support is not just an adjunct to medical transition, but an integral part of comprehensive gender-affirming care. Hormone therapy is a cornerstone of gender-affirming care, helping transgender individuals align their physical characteristics with their gender identity. This therapy involves either feminizing or masculinizing hormones, depending on the individual's gender goals. For transgender women, estrogen and anti-androgens can promote the development of female secondary sexual characteristics, while transgender men may take testosterone to foster male physical traits. Hormone therapy requires careful management by healthcare providers familiar with the specific needs and risks associated with GOT. Medical providers must monitor hormone levels and manage potential side effects, including risks related to cardiovascular health, liver function, and bone density. Unfortunately, access to hormone therapy remains challenging for many transgender individuals due to regulatory barriers, lack of provider knowledge, and limited insurance coverage. Providers need to understand the intricacies of hormone therapy and offer accessible, culturally competent care. In cases where individuals face barriers to in-person health care, telemedicine can play an essential role in delivering hormone therapy safely and effectively. Gender-affirming surgeries are medically necessary for many transgender individuals, but these procedures are often stigmatized and inaccessible. Common surgeries include top surgery, chest reconstruction, bottom surgery, genital reconstruction, and facial feminization or masculinization surgeries, each designed to help transgender individuals feel more comfortable in their bodies and alleviate gender dysphoria. These surgeries require specialized care and extensive pre- and post-operative support. Surgical care begins with thorough consultations where individuals discuss their goals, understand the risks and benefits, and undergo medical evaluations to ensure suitability for surgery. The recovery process can be intensive, involving physical and emotional support, and requires ongoing medical follow-up. Unfortunately, many transgender individuals face financial barriers, as these surgeries are expensive and are often not covered by insurance. A significant number of transgender people also live in regions without providers skilled in gender-affirming surgeries, requiring them to travel long distances, adding to the cost and stress. Expanding insurance coverage and training more surgeons in these procedures can help make these essential services accessible. The primary care needs of transgender individuals are often overlooked or misunderstood, partly due to the effects of hormone therapy and the unique anatomy of transgender individuals. Transgender men, for example, may still need breast and cervical cancer screenings if they have retained these organs, even if they identify and present as male. Conversely, transgender women may need prostate exams, depending on their anatomy and health status. There are also heightened health risks associated with long-term hormone therapy, such as increased risks of cardiovascular disease, diabetes, and osteoporosis. Providers must address these needs through gender-sensitive screening and preventive care. For instance, transgender individuals on estrogen therapy may have an increased risk of blood clots and cardiovascular issues, necessitating regular monitoring of heart health and cholesterol levels. Building trust and comfort with transgender patients is essential in primary care settings, where providers must approach screenings and exams with sensitivity and respect for the patient's gender identity. Using gender-neutral language and intake forms that allow patients to disclose their gender identity and pronouns can help create a more inclusive environment. Reproductive health is an essential aspect of healthcare for transgender individuals, though it is often overlooked. Hormone therapy may impact fertility, and transgender individuals may require family planning options and counseling. Some may wish to preserve their fertility before starting hormone therapy, while others may need guidance on alternative reproductive options, such as adoption or surrogacy. Inclusive sexual health counseling is vital, as transgender individuals may face unique risks and needs based on their anatomy and sexual practices. Providers must offer judgment-free, affirming sexual health education that covers topics like STD prevention and safe practices. For those who choose to undergo fertility preservation, access to affordable cryopreservation services is essential. Mental health support is vital to the well-being of transgender individuals, given the high rates of mental health challenges linked to societal stigma and discrimination. Community support systems, including peer counseling and support groups, provide transgender individuals with a sense of belonging and validation, which is crucial for mental health. Effective mental health care for transgender individuals requires culturally competent providers who understand the complexities of gender dysphoria, discrimination, and transition-related stressors. Integrating peer-led support groups into mental health programs helps create community bonds, fostering resilience and reducing isolation. Additionally, having access to resources such as hotlines and online support can be especially beneficial for those who are geographically isolated or facing unsupportive environments. Discrimination in healthcare settings is a significant barrier for transgender individuals. Many report experiencing prejudice, refusal of care, or inappropriate treatment, leading to mistrust in healthcare systems. To improve access, healthcare providers must undergo training to understand transgender issues and actively work to dismantle biases. Insurance policies often exclude coverage for gender-affirming care, placing transgender individuals in financial distress to access necessary treatments. Even when insurance does provide some coverage, it is often limited or subjected to restrictive criteria. Policymakers and insurance companies should consider the importance of gender-affirming care and cover these services as essential rather than elective treatments. The scarcity of trained transgender healthcare providers, especially in rural areas, limits access to quality care. Telemedicine is emerging as a solution to overcome geographical barriers, allowing transgender individuals to consult with specialized providers remotely. Increasing the number of healthcare professionals trained in transgender care is essential for creating accessible, inclusive care networks. Improving transgender healthcare begins with provider education. Medical schools and professional training programs should include comprehensive transgender health topics to ensure that future providers have the knowledge and cultural competency to care for transgender patients. Specialized training on topics such as hormone therapy, gender-affirming surgeries, and mental health support is crucial. Policy changes are necessary to make healthcare more accessible for transgender individuals. This includes advocating for insurance policies that cover gender-affirming treatments, as well as creating non-discrimination laws to protect transgender individuals from healthcare-related discrimination. Such policies can reduce financial barriers and encourage transgender individuals to seek care without fear of mistreatment. Inclusive healthcare environments foster trust and improve healthcare outcomes for transgender individuals. Clinics and hospitals can make simple changes, such as using gender-neutral intake forms, training staff on proper pronoun usage, and creating visible signs of support, like pride flags or anti-discrimination statements. These steps help transgender individuals feel seen, respected, and safe. Telehealth has the potential to transform healthcare access for transgender individuals, particularly those in rural or underserved areas. Telehealth can provide transgender individuals with direct access to specialized providers and services, making it easier to start or maintain hormone therapy, access mental health counseling, and receive guidance on transition-related needs. Highlighting success stories of inclusive clinics and organizations that provide exemplary transgender care can serve as a model for others. For instance, some health centers have successfully integrated comprehensive gender-affirming services, leading to improved patient satisfaction and health outcomes. Case studies demonstrating the positive effects of gender-affirming care on mental and physical health showcase the real-world benefits of inclusive healthcare practices. The healthcare needs of transgender individuals are unique and multifaceted. From gender-affirming treatments and mental health support to primary care and reproductive health, transgender individuals require comprehensive, respectful, and accessible healthcare. Addressing these needs is not only a matter of individual well-being, but also a public health imperative. By investing in education, policy reform, and inclusive healthcare practices, society can create a more equitable healthcare system that respects and values transgender individuals as they are. Finally, we would like to express our gratitude for watching till the end. We hope you found the video valuable and informative. If so, please show your appreciation by hitting the like button and leaving us a comment below. We are eager to hear from you. In the end, we have a humble request to you. We are trying hard to keep you enlightened and empowered by creating awesome videos like this. Please support us by joining our membership program. The link is in the description. Your little contribution will inspire us to make more awesome content for you like this. The next video will be published tomorrow, so don't miss it. Till then, take care. More wisdom, more solutions, better life.